Welcome back to another MedRevisions video. So today we'll be discussing a May 2021 recall and also give you some helpful tips for the upcoming exams. And hopefully that will bring you one step closer to passing the PLAB 1 exam. Alright, let's dive right into the video. Before we discuss the question, please take 50 seconds to pause the video and comment the answer down below. Alright, so let's get to the question. We have an 87-year-old woman who presents with increasing confusion, agitation, and restlessness. She has recently moved into a nursing home and has been tearful for the past 2 days. Her past medical history includes dementia, hypothyroidism, COPD, for which she takes donepezil, levothyroxine, and ipratropium inhaler respectively. On examination, she has a pulse rate of 96 ppm and a blood pressure of 138/86 and a respiratory rate of 18. Her chest is clear. What is the most likely diagnosis? The correct answer here is delirium. Well, before we discuss the correct answer and the other options, don't forget to smash that like button like you would during CPR. Okay, and also comment down below on any other topics that you'd like us to cover in the upcoming videos. Make sure you check out the reviews from our past PLAB 1 candidates. The link is in the description below. So we have some exciting news for you. Go check out our new update where we have our new study notes which you can study before you attempt the questions. And we also have our revision notes, which is the added new feature where you get the highlighted parts and the key points to make it easy for you to do your revision. And the other thing is, once you are done with the notes, you can attempt those particular questions that come under those notes separately, any section you like. So do check it out. Okay, back to the question. So as I said before, the correct answer is delirium. And why that is because now dementia and old age are the biggest risk factors of delirium. Now, the patient is likely suffering from an infection, possibly a UTI. She probably caught it after moving to the nursing home. And a chest infection is ruled out due to the clear chest examination. Okay, and delirium due to infections is very common among the elderly, and it can also be caused by an unfamiliar or disorientating environment, constipation, and poor nutrition. Although this question has given us a lot of information that is not really necessary, it's just given to throw you off and distract you. Okay, so that is a correct answer. And now depression is unlikely, although she has been tearful for the past 2 days. It is not a clinical diagnosis of depression because it has only been recent, and the worsening confusion and agitation point more towards delirium rather than depression. And also anxiety. Now, anxiety presents with restlessness and nervousness, and this patient has a history of several major comorbidities including dementia and COPD. Okay, and her age puts her at an increased risk of confusion. Therefore, this is not the correct answer. And hypercalcemia, again, it is another cause of confusion. However, there's no information that's given to us that points towards hypercalcemia, like constipation, or thirst, or bone pain, things like that. And lastly, drug withdrawal. Now, she is taking several drugs due to her comorbidities, and confusion can be caused by withdrawal reactions and drug interactions. Although it is likely to happen, delirium is better suited answer, so this is the more likely answer in this clinical scenario. Alright, so that's it for this video. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.